Hi, my name is Dr. Tim Liddy from Liddy Podiatry and Prevention. Today I'd like to talk just for a moment about plantar fasciitis, whether you're an amateur athlete or a pro. When you're working out heavily and your heel starts to hurt and your arch starts to hurt, the most common diagnosis is plantar fasciitis. It's a soft tissue injury to the fascial band that helps support the bottom of the foot during your exercise activities. When it becomes a problem, there's a lot of non-surgical approaches that have high efficacy. We really can help people with orthotics, injections, therapies, even home stretching, massaging, icing work very well to mitigate some of the pain and inflammation associated with fasciitis. However, in some of the cases where it becomes recalcitrant, it continues beyond the pale. It is a very painful condition that can prevent a person from really accelerating into their physical activity and preventing them really from becoming the runner or the athlete that they want to be. Under those circumstances, we use a more advanced technique called TenJet Plantar Fasciotomy. It's a minimally invasive procedure. We use a small incision, approximately 2 or 3 millimeters. It doesn't even require a suture. The procedure itself takes about 15 minutes to perform. It's performed under local anesthetic, and sometimes we use sedation to help a patient just sleep for the procedure and wake up when it's over. And under those circumstances, we can actually denude or remove the hypertrophic scar or that chronic recurring type of fibrosis that builds up on the tendon. The TenJet Plantar Fasciotomy is a very effective tool. We're going to show you an intraoperative event where we use our diagnostic ultrasound. Sometimes we'll even proceed the procedure with some magnetic resonance imaging to understand the severity and the location of the injury. But once we have that data, we can perform this procedure very efficiently and effectively. The patient gets back on their feet within a couple of weeks and then return to full activity in approximately 4 weeks. It's an incredibly effective tool that we can use for the more recalcitrant or recurring types of plantar fasciitis types of injuries. Thank you. Performing a TenJet minimally incision plantar fasciotomy using a TenJet system. Today I'm just demonstrating how we can utilize guided ultrasound to visualize the image of the plantar fascia. If you could just show the calcaneus plantar tubercle, this dense white line, and above it we can start to see this black hypoechoic area, which is an area of fasciosis or scar tissue. We utilize this minimally invasive minimal incision technique so that we can access that fascial band using the HydroJet system. You can see a little white light area and a jet stream coming across as we penetrate and fenestrate the fascial band, and you can start to see it go from a hypoechoic tissue to a hyperechoic tissue. You can see it right there, that dense white area. This tends to solve the scar tissue that has formed over the years, and it helps to strip off that material using the TenJet system. Once this procedure is finished, we use an amniotic allograft. This is a fantastic technique to utilize the latest in regenerative medicine, and then that helps to the tissues heal in a more rapid and with less inflammation technique. Thank you.